Samantha McIntosh is one of the senior doctors at a large hospital for military veterans here in Washington. She says that starting in the 1990s, the idea of testing and comparing different medicines and treatments started getting much more attention. She says this was largely the result of the explosion of information technology that has enabled the collection and manipulation of huge amounts of data about patients.
Evidence-based medicine really came about in the last couple of decades, and it was a response to the increasing amounts of scientific research data available and at our disposal to help in the care of patients. We teach evidence-based medicine to medical students and medical trainees nowadays to assist them to ask a question that pertains to the care of their patient, to access that medical data, sift through it, find the data that would support an answer to that question.
The idea of using rigorous scientific studies to show which treatments are better and not just relying on tradition or on the opinion of a few experts has led to some major changes.
Things that we used to do, when I was in medical school, that was less than, 20 years ago, are now obsolete. We used to routinely provide hormone replacement therapy for women, in their 50s or 60s, and now we know that that has undesirable side effects that outweigh the benefits that we thought they once had, based on studies that have come out.
Every year, hundreds of new drugs come on the market. The big pharmaceutical companies that produce most of them typically promise great results while downplaying any harmful side effects. Dr. Jeffrey Eickhoff, a resident doing a specialization in internal medicine, says doctors must learn to read the medical literature critically.
Certainly with any new medication that comes out or any new treatment modality, there are other interests at play as well. The pharmaceutical companies, for example, they put a lot of money and time into their medications, and they will certainly play up the benefits of the medication and maybe downplay somewhat the side effects. And so actually looking at the raw data that's out there, looking at the study itself, and interpreting it yourself, I think is important.
Dr. McIntosh says medical schools now try to teach future doctors how to search for reliable information and, just as importantly, how to discuss the pros and cons of competing treatments with the patients themselves.
It's really a response to the sheer amount of information that is available. There are tens of millions of articles in the database PubMed, which is the database of the U.S. National Library of Medicine, maintained by the National Institutes of Health. And it's grown exponentially over the past 2 decades. So clinicians today really need to have the skills to be able to access those databases, search them correctly, and when they arrive with a handful of articles to review, they need to read them critically. Just because a study is published doesn't mean that the conclusion that it draws is sound. And probably the most important skill, as I mentioned before, is to take what they learn and bring it back to the bedside, to be able to discuss it with their patient, to be able to involve the patient in his or her own medical decision-making.
For example, some patients may prefer to use a well-established drug, even if it requires them to come to the hospital each week for blood tests, while other patients may opt for a newer, less proven drug if it does not require them to come in so often. Modern medicine began at the end of the 19th century, when doctors started dropping old, unproven methods. We are now in the midst of a new medical revolution, where the mounds of data collected by computer systems offer new tools to determine which treatments work best. For Saudi Good Morning, this is Burton Bolag in Washington.